In Unit 14, we will discuss procedures used to diagnose disease, disorders, and injuries. Information about the diagnosis is used to identify therapeutic interventions. The learning objective for Unit 14 is to write the names of diagnostic terms and pathologies related to each body system and match those terms with their meanings. Diagnosis is identification of an injury, disease, or condition based on the patient's symptoms and signs using various sources of patient data. Symptoms are subjective evidence of the problem that are perceived by the patient. Examples of symptoms are pain and nausea. Signs are objective evidence perceived by the healthcare provider who is examining the patient or established from sources of patient data. Examples of signs are fever, high blood pressure, or proof of a fracture from radiologic testing. There are several sources for acquiring patient data, including the patient history and physical examination, commonly called the H&P, Diagnostic Imaging Studies, Electrodiagnostic Studies, Endoscopic Procedures, results of laboratory analysis, and additional more specific or more sophisticated tests. The patient's comprehensive medical history is likely on file with the primary care provider and can easily be obtained by request. Information related to the patient's current problem will likely be obtained by having the patient or a relative or close friend complete a questionnaire, or the information is acquired verbally as the healthcare provider questions the patient and listens to the answers provided. Based on the patient's history, the healthcare provider will likely perform an examination of the patient. The examination will likely involve visualization, palpation, and/or auscultation. A key component of the physical exam is to obtain the patient's vital signs. Vital signs include temperature, pulse and respiratory rates, and blood pressure. Vital signs are considered normal when they fall within a pre-established range. Abnormal results are indicators that a specific problem exists or that additional testing may be indicated. Based on the results of the history and physical exam, a preliminary diagnosis is established and additional testing may be needed to prove the diagnosis. Diagnostic imaging studies may be indicated. Imaging studies produce an image or picture of the inside of the body. Examples of diagnostic imaging studies include diagnostic medical sonography, also referred to as ultrasound, which uses high-frequency sound waves rather than radiation to create a computer-generated image of body structure. Radiography involves passage of an X-ray beam through the body. A portion of the beam is absorbed or scattered by the internal structure, and the remaining pattern produces an image which is recorded on film or digitally. Mammography, low-dose radiation of the breast, is used for early detection of breast cancer. Cardiac catheterization, insertion of a long, thin tube called a catheter into an artery or vein of the groin, neck, or arm, is used to inject contrast media in order to diagnose and treat cardiovascular conditions. And computed axial tomography scanning technology that combines a series of X-ray images taken from different angles to create cross-sectional images or slices of the bones, blood vessels, and soft tissues are all examples of radiography. Radioisotope imaging involves injection of a small amount of radioactive material into the patient's vein, waiting a short time for the material to travel to the target tissue, and undergoing a scan with a special instrument called a gamma camera to produce an image of the amount of material taken up by the target tissue. Magnetic resonance imaging, or MRI, uses a magnetic field and radio frequency pulses to produce a detailed computerized cross-sectional image of internal body structures. Based on preliminary results of basic diagnostic imaging studies, other more specific and sophisticated studies may be indicated. Electrodiagnostic studies measure the electrical activity of muscles and nerves to confirm that a structure is functioning normally or identify any malfunction. Electrodiagnostic studies are performed on muscle and nerve tissues. The electrocardiogram examines the electrical activity of the heart to detect irregularities of the heartbeat. The electroencephalogram records brain activity, and the electromyogram evaluates the electrical activity of muscle while at rest and when contracting. Endoscopic procedures allow for visual inspection of the inside of the body using an illuminated instrument with a lens called an endoscope. Frequently, a camera is attached to the endoscope that allows the healthcare provider to view the body structure on a monitor. The endoscope may be inserted via a natural body opening or through a small incision. Gastroscopy involves insertion of a scope through the mouth, pharynx, and esophagus into the stomach. Arthroscopy is viewing of a joint, and laparoscopy is viewing of the abdomen. Both arthroscopy and laparoscopy require the use of a small incision to allow passage of the scope. Tissues and fluids removed from the body are examined in the laboratory. Examples of laboratory exams include hematology, which is the study of blood, urinalysis, which is the study of urine. Bacteriological tests, such as culture and sensitivity or the Gram stain, are used to identify specific bacteria and determine which antibiotic will provide the most effective treatment. Tissue testing that includes biopsy and cytology studies are used to determine the presence of cancer or other abnormal cells. Based on the results of basic diagnostic studies, either a diagnosis is identified or other more specific, sophisticated, expensive, and time-consuming studies may be indicated as the search for a diagnosis continues. In summary, you have learned the definition of the term diagnosis and are now able to list and describe several diagnostic procedures. Based on the patient's diagnosis, a prediction about the expected outcome of the disease, called the prognosis, can be made.